Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Bachelor's Degree Programs. Post-Basic Bachelor of Science in Nursing B.Sc.N, PB BNS-106 Medical Surgical Nursing. Block-1 Advanced Medical Surgical Nursing. Unit-1 Introduction to Medical Surgical Nursing. 1.0 Objectives. On completion of this unit, you will be able to discuss the various concepts of medical surgical nursing, explain disease process, discuss how the role of medical surgical nursing differs in adopting different approaches for care, describe the challenges confronting medical surgical nurses in various settings in the hospital, discuss the ethical considerations in medical surgical nursing practice, explain the implications of Consumer Protection Act on medical surgical nursing practice, and state common legal aspects in medical surgical nursing practice. Asepsis or clean technique includes procedures used to reduce and prevent the spread of microorganisms. Hand washing, using clean gloves to prevent direct contact with blood or body fluids, and cleaning the environment routinely are examples of medical asepsis. In medical asepsis, area or object is considered contaminated if it contains or is suspected of containing pathogens, e.g., a used bedpan, the floor and a wet piece of gauze are contaminated. The nurse follows certain principles and procedures to prevent infection and control its spread. During daily routine care, the nurse uses basic medical aseptic techniques to break infection chain. The nurse is responsible for providing the client with a safe environment. The effectiveness of infection control practices depends on the nurse's consciousness and consistency in using effective aseptic technique. It is easy to forget key procedural steps. 1. When hurried to take shortcuts that break aseptic procedures. However, the nurse's failure to be meticulous will place the client at risk for an infection that can seriously impair recovery or lead to death. You learnt about 111 medical aseptic techniques in BNS-101. Let us recapitulate. Various medical aseptic techniques/procedures. Cleaning. Cleaning is removal of all foreign material, such as soil or organic material. Generally, cleaning involves use of water and mechanical action with or without detergents when an object, e.g., glove, comes in contact with infection's content. It is usually discarded unless hospital policies and procedures are there for reprocessing the object. Reusable objects must be cleaned thoroughly before reuse and then either disinfected or sterilized. Control or elimination of infectious agents. Proper cleansing, disinfection, and sterilization of contaminated objects significantly reduce and often eliminate microorganisms. In hospitals, CSSD disinfects and sterilizes reusable objects/supplies. Disinfection and sterilization. Disinfection refers to a process that eliminates many or all microorganisms, with the exception of bacterial spores. Examples of disinfectants are alcohols, chlorines, phenols, etc. Sterilization is the complete elimination or destruction of all microorganisms, including spores. Steam under pressure, ethylene oxide gas, are the most common sterilizing agents. Nurses should be familiar with hospital policy and procedures for cleaning, handling and delivering items for even-held disinfection and sterilization. Hand washing. The most important and most basic techniques in preventing and controlling transmission of infections is hand washing. Hand washing is a vigorous rubbing together of all surfaces of the hand lathered in soap, followed by rinsing under a stream of water. The purpose is to remove soil and transient organisms from the hands and to reduce total microbial count over time. Contaminated hands are a prime cause of cross-infection. Plain soap with water can be used for general hand washing, but if it is necessary to kill or inhibit microorganisms, such as in a surgical procedure. Antiseptic agents should be used. 1.2.3 Meeting basic needs. These needs are basic to all people and require satisfaction accordingly. Such needs are addressed on basics of priority, meaning that some needs are more pressing than others. Once an essential need is met, a person experiences a need on higher level. Basic human needs are elements that are necessary for human survival and health, e.g., food, water, safety and love. Although each person has other unique needs, the basic human needs are shared by all people, and the extent to which basic needs are met is a major factor in determining a person's level of health. Maslow's hierarchy of needs is a model that nurses can use to understand human needs, Figure 1.1. According to this model, certain human needs are more basic than others, i.e., some needs must be met before other needs, e.g., fulfilling the physiological needs before the needs of love and belongingness. You may refer BNS 101 also. Maslow's hierarchy of needs includes 5. Self-actualization. 4. Self-esteem. 3. Love and belonging needs. 2. Safety and security. 5. Cell safety. Psychological safety. 1. Physiological. Oxygen, fluids, nutrition, body temperature, elimination, shelter, sex. This model can provide a basis for nurse and clients of all ages in all health settings. Abraham Maslow, 1908 to 1970, developed a theory of human needs from his study of individuals without physical or mental illness. He described an ordering, hierarchy, of needs that motivate human behavior, i.e., often depicted as a pyramid composed of 5 levels. When the most basic needs for hunger, thirst, and so on have been fulfilled, the person strives to satisfy these needs for safety and security on the next higher level. The highest level is of self-actualization, i.e., the realization of one's potential. This theory has made a valuable contribution to understand human development through its positive viewpoint and recognition of needs that motivate all humans. It has also been criticized for not differentiating needs according to ages. 1.2.4 Problem-based approach. Problem-related approach focused on the problem for assessment. The assessment begins with the problematic area such as pain and spreads out to relevant areas of the client's life. A comprehensive pain assessment begins with the review of the nature of the pain itself and then broadens to categories such as the influence of pain on lifestyle, family relationships and work habits. Once completed, the problems of pain will be thoroughly analyzed so that a comprehensive approach can be used to plan interventions directed toward pain relief. This approach enables the nurse to cluster cues of assessment data and she can identify the emerging patterns and potential problems. Problem-related approach is used in the nurse's collaborative role. The nurse makes clinical observations of a client, reports the client's situation relative to a medical problem, and then follows delegated medical activities prescribed by the physician. In the independent role of a healthcare provider, the nurse assesses a client's healthcare needs and institutes nursing interventions to maintain or improve the client's health. Accurate assessment is crucial to ensure needs/problems are properly identified and the right course of action is implemented by the nurse. 1.2.5 Holistic approach. Let us now view how holistic healthcare approach is different from the traditional problem-focus approach. Since the 1980s, traditional healthcare has more frequently been accompanied by the use of holistic therapies. The holistic view considers the body, mind, and spirit to be interrelated parts of a person's being. The concept of high-level wellness, which considers the needs of the whole person, has led to the growth of holistic healthcare. Holistic health focuses on promoting health and preventing illness, with an emphasis on the person's responsibility to achieve high-level wellness. There is also concern with bringing the person's mind, body, and spirit into harmony with the environment. A holistic approach to health reconnects the traditionally separate approach to mind and body, Figure 1.2. Factors such as physical environment, economic conditions, sociocultural issues, emotional state, interpersonal relationships. Factors influencing health. Previous health experiences. Physical environment. Economic conditions. health beliefs practices, sociocultural, support systems, emotional state, interpersonal relationships, support system. Health beliefs or practices and previous health experience can work together or alone to influence health. This connection among physical health, emotional health and spiritual well-being must be understood and considered when providing health care. It is the nurse's conceptual integration of the physiologic health conditions with the emotional and social context, along with the task and developments of the patient's life stage that allows the development of a holistic plan of nursing care. 1.2.6 Assisting sick and well individuals. A person's state of health directly influences his/her daily choices, independence, individuality and lifestyle. Therefore, health is an integral aspect of an individual's identity. Plawecki, 1997. An assessment of the client's state of health is an important aspect of nursing. Nurses are in the unique position to assist clients in achieving and maintaining optimal levels of health. Nurse understands the challenges of today's healthcare system and embrace the opportunity to use wellness activities to promote health and prevent illness. In an era of cost containment and advanced technology, nurses can be a vital link to improved health of individuals and society. Nurses also identify actual and potential risk factors that predispose a person or a group to illness. Risk factor modification strategies may be used by the nurse in an attempt to promote health or prevent illness. When illness does occur, different attitude about illness cause people to react in different ways to illness or that of a family member. This is called as illness behavior. Nurses who understand how clients react to illness can minimize the effects of illness and assist clients and their families in maintaining or returning to the highest level of functioning. 1.3 Types of illness. Illness is a state in which a person's physical, emotional, intellectual, social, developmental or spiritual functioning is diminished or impaired compared with previous experience, e.g., cancer is a disease but one client who is responding to treatment may continue to function as usual, whereas another client may be affected in dimensions other than physical. Illness, therefore, is not synonymous with disease. Although nurses must be familiar with different kinds of diseases and their treatments, they are concerned more with illness, which may include disease but also the effects on functioning and well-being in all dimensions. Acute and chronic illness are two general classifications of illnesses. Focus of medical surgical nursing is on the adult client with acute or chronic illness in any healthcare setting or on the client who is at risk for illness. 1.3.1 Acute illness is characterized by symptoms that are of relatively short duration, are usually severe, and affect the functioning of the client in all dimensions. It is usually self-limiting or respond readily to a specific treatment, e.g., rhinitis. 1.3.2 Chronic illness. Chronic illness are illness that lead to at least some of the following characteristics. 1. Permanent impairment or deviations from normal. 2. Irreversible pathological changes. 3. Residual disabilities. 4. Special rehabilitation. 5. Long-term medical and nursing management, e.g., diabetes mellitus, arthritis. 1.3.3 Terminal illness. Illness that because of its nature can be expected to cause the patients to die, usually a chronic disease for which there is no known care. 1.4 Role of medical surgical nurse. Nurses who specialize in medical surgical nursing need to have broad knowledge of the biological, psychological and social sciences because of their range of clients. The overall outcome of care is similar to that for any other specialty. As medical surgical nursing meets changing healthcare needs, the expectations for providing care expands and increases. Medical surgical nurses assume various roles and functions within a number of healthcare settings. Figure 1.3. Although each role is associated with specific responsibilities, some aspects are interrelated and are common to all nursing positions and specialties. Nurses practice on the basis of thinking. Nursing professionals are responsible and accountable for their own nursing actions. Assertiveness has become not only valued, but also essential to the practice of nursing. Each nurse caring for a client is responsible for his or her own actions on behalf of that person. Nurses must communicate promptly with their nursing colleagues, subordinates, and superiors as well as other healthcare professionals about changes in the client's status and the client's response to care. Critical thinker. Critical thinking, sometimes referred to as clinical reasoning or judgment, an essential competency that all nurses need to provide quality, cost-effective client care. Critical thinking is a purposeful, outcome-directed thinking that aims to make judgments based on scientific evidence rather than tradition or conjecture, guesswork. Evidence is most often the result of research. The term evidence-based practice is used to describe the care that nurses provide based on research and identified standards. Coordinator of care. The nurse cannot provide all of the care that a client needs. As a care coordinator, the medical surgical nurse collaborates with the healthcare team to help the client meet expected outcomes identified in the interdisciplinary plan of care. Nurses are expected to serve as advocates for their clients. Caregiver. Another role commonly associated with the medical surgical nurse is of caregiver. In this role, nurses assess clients' needs, analyze collected information to determine clients' needs, develop nursing diagnosis, plan care, carry out the plan with the healthcare team, and evaluate the care given. This process is referred to as the nursing process. Continuing care planner. Because healthcare today emphasizes early discharge from the hospital, the role of a medical surgical nurse as continuing care planner has become increasingly important. This process involves an assessment of clients' health needs across the health continuum. Continuing care planning may be coordinated by the discharge planner, who usually is a nurse. Educator. Client education is a major component of medical surgical nursing care. The role of educator has become increasingly important because clients are discharged quicker and sicker from the hospital. Contrary to the traditional belief, medical surgical nurses must become concerned about the high cost of health care, and recognize that it is far less expensive to teach people healthy ways of living than to treat illnesses resulting from bad health habits. After learning the general role of a medical surgical nurse, we will now learn about her role in some specific settings: inpatient medical surgical unit, outpatient medical surgical unit, specialty units and rehabilitating unit. 1.4.1 Inpatient medical surgical unit. Nurses working in the inpatient units must be able to adapt to caring for clients with various types of medical surgical disorders and must be competent in health teaching and discharge planning. Nurses must also be highly skilled in critical thinking and counseling. 1.4.2 Outpatient medical surgical unit. The outpatient unit is an important part of the hospital. This is the point of contact between the hospital and community. Nurses working in outpatient unit should be competent in history-taking, health assessment and health education/patient education skills. 1.4.5 Ambulatory care unit. The term ambulatory care refers to care delivered to client in different settings in which the client can ambulate. Ambulatory care is quickly becoming the prevalent mode of care because it costs less or in the preference of clients to remain in their home and their community, e.g., ambulatory surgical centers. 1.5 Ethical and legal considerations. As the healthcare industry continues to undergo dramatic changes, nurses are increasingly confronted by diverse ethical issues. Advances in medical technology and the limitation of healthcare resources create complex ethical situations that challenge nurses daily. The nurse's unique professional relationship with clients and families makes it mandatory that the nurse be responsibly aware of client healthcare issues and the ethical dimensions of nursing practice. You have already shades about ethical and legal implications in nursing in BNS 101. In this unit, review will be done on Consumer Prefect Act and legal elements in medical surgical nursing. 1.5.1 Consumer Protection Act. Consumer Protection Act, CPA, was passed by the Parliament in 1986 to provide for better protection of the interest of consumers and focuses on consumer justice through the establishment of consumer councils and other authorities for the settlement of consumers' disputes and matters connected therewith. The scope of the Act is wide enough to include a vast variety of services. Under this Act, consumer can complain in redressal forum. It enabled the consumer/patient to make a complaint to a redressal forum in respect of defective services provided. Rights of a consumer/patient are: right of safety, right to be informed, right to choose, right to be heard, right to seek redressal, right of consumer education. Note, for details, you may refer to the context of CPA Act, 1986 in BNS 101. 1.5.2 Legal aspects in medical surgical nursing. The uniqueness of nursing, which embodies a concern for the client in every aspect of life, encompasses a great responsibility, one that required knowledge, skill, care and commitment. As society advances and technology changes, the issues that affect nursing practice also change. For example, we continue to recognize the importance of informed consent, of the right to decide what is best for oneself and to believe in the client's Bill of Rights. Today's nurse needs to be informed on these. Refer to basic legal concepts and legal aspects of nursing in your course on Nursing Foundations, BNS 101. Basic legal concepts. It is useful to have a working definition of some basic legal concepts before applying them to a healthcare setting. Laws are rules of conduct that guide the interactions among people. Laws are binding, enforceable, and necessary so that people can live and work together. If laws are broken, a penalty is incurred. Sources of law. There are two primary sources of law: statutory law and common law. Statutory law is enacted by legislative bodies such as Indian Nursing Council or licensing bodies such as state registration councils. Statutory laws are fixed and rarely change. However, there cannot be a law to regulate every single situation. Situations come up between people that have not been anticipated. Thus, we have what is known as common or case law. These are judicial decisions that can change on a case-by-case basis. Previous decisions may be used to help determine similar cases but are not carved in the legislations. Good Samaritan law. The Good Samaritan law states that a healthcare professional who aid accident victims when off-duty will not be liable for untoward result related to his/her acts. However, if they act willfully with gross negligence, a judgment of liability is possible.
Nursing practice and the law. Nursing practice falls under both the criminal and civil sectors. Nurses are bound by rules and regulations stipulated by the Nursing Practice Act and as determined by the legislatures such as Indian Nursing Council and state nursing councils. These laws are to protect the public. If these laws are broken, the nurse can be punished by paying a fine, losing her license or by being incarcerated. An example of this could be a nurse guilty of diverting drugs. This is a crime against the state. The nurse could lose her license and go to jail. This is classified under criminal laws. Civil laws deal problems that occur between a nurse and the client. For example, if a nurse does not put side rails for an unconscious patient and he sustains injury by a fall, the client may file a civil suit against the nurse. The client may receive compensation for injuries, but no jail time is incurred for the nurse. Standards of practice. Guidelines have been developed to direct nursing care. These guidelines are called Standards of Nursing Practice. You may refer to your course on Nursing Foundation, BNS 101, where standards of nursing practice are discussed in detail. Standards of nursing practice are derived from a variety of sources, e.g., licensing body, hospital, etc. Policy and procedure manuals also represent standards of practice. The nurse is expected to follow the guidelines laid out by the policy and procedure manuals. The nurse is expected to exercise good judgment in the planning and providing of client care. In other words, nurse is expected to act in a reasonable and prudent manner. Documentation. The best place to determine what takes place in a client's clinical history is the medical record or the chart. The chart should be accurate reflection of diagnosis, treatment, testing, clinical course, nursing assessment and intervention. According to law, if it was not charted, it was not done. Chart events as they happen. Do not wait until the end of the day. It is difficult to remember what takes place on an 8-hour shift, especially when caring for more than one client. Do not chart medications before they are given or treatment before they are completed. It is a direct violation of standards of practice for documentation and medication administration. Use only accepted abbreviations. If in doubt, write it out. Documentation must be accurate and objective. Nurses' notes must reflect facts, not inferences or opinions about the client. Entries must be neat, legible, spelled correctly, and written clearly. It is illegal to go back and change a chart. If an error in charting is made, simply draw a line through the incorrect entry and initial it. Do not scribble or use white correction blind. Sloppy, misspelled charting might discredit excellent nursing care. Make the medical record work for you, not against you. Informed consent. Informed consent refers to the client's ability to make healthcare decisions based on full disclosure of benefits, risks, potential consequences of a recommended treatment plan, and alternative treatments, including no treatment. This detailed explanation, provided by the physician nurse, allows the client to make intelligent decisions about treatment options. The issue of informed consent deals with the right of the client to determine what happens to his/her person. Consent to treatment frees the healthcare worker from unwarranted charges of battery. Whose legal responsibility is to obtain consent? Nurses must obtain consent for nursing procedures. Each client on admission signs a general consent form. The responsibility for informed consent has been assigned, by law, to the physician. This duty cannot be delegated. It is the physician's responsibility to obtain consent for medical or surgical treatment. However, confusion arises because nurses are often delegated the duty of collecting the signature for invasive procedures such as surgery, cardiac catheterization, and other diagnostic procedures. Student nurses are not to ask the client to sign a consent form, nor do they witness a consent. The nurse's role in informed consent. When a nurse has a client sign a consent form, the nurse must verify 3 things. 1. The client's signature is authentic. 2. The client has mental capacity to understand the things discussed with the physician. 3. The client was not coerced into signing the form. Clients over the age of 18 may give consent for their own health care. Parents or guardians give consent for minor children. In an emergency situation when immediate action is necessary to save a life or prevent client from permanent physical harm, consent is implied. Written consent is waived. Once the emergency is over, consent must be obtained for any further care. Consent may be withdrawn, either verbally or in writing, at any time. 1.6 Let us sum up. In this unit it is tried to help you learn the various concepts of medical surgical nursing which can be applied to the nursing practice in various settings. The concepts discussed are meeting basic needs of patients, relationship of disease and pathogenesis and asepsis to prevent cross-infection. You have also read about problems-based approach and holistic approach in providing comprehensive nursing care. Further, you have also learned various roles of a medical surgical nurse related to types of illness, i.e., acute, chronic or terminal, as well as in various medical surgical units, i.e., inpatient, outpatient, specialty and rehabilitation units. Finally, you have learned about the ethical and legal considerations including the Consumer Protection Act. The nurse's unique professional relationship with clients and families makes it mandatory that the nurse be responsibly aware of clients' healthcare issues and the ethical dimensions of nursing practice. Today's nurse needs to be informed for the legal aspects in medical surgical nursing practice. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.